My name's David Ford. I'm an Associate Director for Quality Programmes with BLNK CCG, working with Anne-Marie, our Chief Nurse, on two specific transformation programmes around improving the care and outcomes for people with learning disabilities and also improving care and outcomes for mums, babies and families through our maternity transformation services. And then I also support Anne in a number of other different areas as they crop up.
So what does a day in the life look for you?
Oh, well, a day in my life can be very diverse as I work in two very different areas of learning disabilities and maternity. So it can range from having one-to-one meetings with colleagues to help and support them in the work and the programme management side of things, through to chairing partnership boards or partnership meetings with colleagues, bringing together people from our local authorities, from NHS providers and from other organisations with an interest in both maternity or learning disabilities. Also, as a senior nurse, I do support the wider clinical and quality team with any specific challenges that come up. And more recently, I've been assisting in chairing some meetings with our safeguarding teams around some people who've got particularly complex needs or areas where organisations need to be brought together to meet a person's needs in a more effective way.
So how is integration as part of your role benefiting patients?
I see, yeah, integration's just being really, really helpful. So in particular, I'll focus on learning disabilities to start with. So working in closer collaboration between health commissioners, health providers, and then our colleagues in social care and our local authorities, and are working more closely and breaking down some of the previous organisational barriers we had has been really helpful. So what this means is that the end users, people with learning disabilities or autism, are getting a more joined up approach and a more consistent approach. In terms of in the maternity world, the integration means that we're getting much more consistency across our three maternity units across the Luton site, Bedford site and Milton Keynes service. Between the two hospital trusts, we get a lot more consistency, improving standards, improving outcomes for mums and babies, with an ultimate goal of reducing those poorer outcomes that they can experience.
If you could give one piece of advice to someone who's interested in working in NHS quality, what would it be?
I'll do it would be the first bit of advice. You get to work across such diverse areas and the ability to actually feel like you're having a direct impact on improving outcomes for people without necessarily being involved in their direct care. In spite of being a few steps away from direct care, I still feel really involved in and really impactful in improving things for people.